Picture this. Tomorrow morning, you wake up with that familiar, confident hardness again. Not from pumps, procedures, or pills, but from a few minutes of focused, purposeful touch you give your own body. No gadgets, no medications, just simple, targeted stimulation that kickstarts your natural erection response. This routine works off a straightforward concept. Small, specific actions that boost local blood flow, activate pelvic muscles, and heighten nerve response so those automatic morning erections return. I'm Dr. HANA Kim, specializing in men's sexual health. In this session, I'm walking you through 3 key pressure points located on and around the penis and pelvic region, why each one matters, and a safe step-by-step method you can apply every day. If you've been missing those spontaneous morning erections, this plan shows how to press, where to press, and how frequently to repeat for real improvements. Why it works ties directly to how erections happen. They aren't random events. They rely on a coordinated system between your nerves, brain, spinal cord, blood supply, and pelvic musculature. Nerves send signals that allow smooth muscle inside the penis to relax, letting blood rush into the corpora cavernosa. As that tissue expands, veins compress and trap the blood, creating firmness. With age, nerve communication slows down and arteries lose flexibility. That combination, less blood flow and weaker signals, is one of the biggest reasons morning erections fade after the age of 50 or 60. Applying pressure to the right points stimulates sensory, nerves, and reflex pathways. This sends a wake-up message throughout the system, encouraging arteries to widen, muscles to relax, and erectile tissue to fill more easily. Some of these points also connect with pelvic floor muscles, the supportive sling beneath your pelvis that helps control firmness and ejaculation. Activating these reflexes can strengthen that muscle group and improve your ability to both achieve and hold an erection. Think of this routine like a gentle reboot. Done consistently, it helps restore nerve sensitivity, improves vascular flexibility, and reactivates natural reflex patterns. Where to begin and why? The first location is the base groove, the spot where the shaft meets your pubic region. Glide your fingers along the underside of the shaft toward your body, and you'll feel a slight hinge or dip where the erectile tissue anchors into the pelvis. Beneath that skin lies a rich cluster of nerves and important vascular pathways that supply the penis. Stimulating this exact area engages both circulation and nerve signaling right at the source, setting the stage for stronger erections. Technique. Place your thumb directly on the base groove while supporting the back of the shaft using your other fingers. Apply slow, consistent circular pressure, firm enough to feel the tissues respond, but never painful. Let the motion be unhurried so warmth can build under your thumb. Begin with a moderate touch and increase only if the area softens comfortably. You might notice tingling, warmth, or a gentle swelling sensation as blood flow improves. If there isn't much feeling at first, don't worry. Progress typically becomes noticeable after repeated practice. How long and how often? Work the base groove for roughly 90 seconds once a day. The best times are in the morning when your body is naturally relaxed, or during a warm shower when heat already enhances circulation. Daily consistency is what reconditions both the vascular and neural components involved in morning erections. Location 2. The perineum is the soft stretch of tissue between the anus and the scrotum. Beneath this spot sits the bulbospongiosus muscle, one of the key pelvic floor muscles that helps trap blood inside the penis to keep it firm. When these muscles lose strength, maintaining erections becomes more challenging. Working the perineum stimulates these muscles reflexively, helping restore tone and function. How to activate it? Recline or sit comfortably with your legs slightly apart. Use your index and middle fingers, or even the heel of your hand, and press into the center of the perineum with gentle but firm pressure. Move slowly in small circles. The pressure should feel solid yet pleasant, never painful. You might notice warmth spreading toward the shaft, or a rhythmic pulsing sensation as circulation improves. Spend 2 to 3 minutes here, keeping the motion intentional and controlled. Pairing with pelvic floor work. To boost results, follow with a few pelvic floor contractions, similar to Kegels. Tighten the pelvic muscles for 3 to 5 seconds, release, and repeat several times. The massage primes the muscles, and the contractions build strength, helping the muscles better support erectile rigidity over time. Location 3. The corona is the raised ring where the head of the penis meets the shaft. This ridge contains a very high concentration of nerve endings. Gentle stimulation here heightens nerve communication with the spinal erection pathway, allowing the shift from arousal to full erection to happen more smoothly. How to work it. Position your thumb and forefinger on either side of the corona near the glands. Lightly pinch the ridge and hold for about 5 seconds before releasing. Continue that hold and release pattern for roughly a minute. Follow this with slow circles along the corona for another minute, enough to stimulate but not irritate. Maintain steady, moderate pressure. If the sensitivity gets too intense, lighten your touch and reduce speed. Why gentle matters? Because this area is extremely sensitive, pressing too forcefully or rubbing too aggressively can overload the nerve endings and actually hinder responsiveness. The main goal is careful retraining of sensation, not overstimulation. Putting the 3 points together into one routine. Base groove, about 90 seconds of slow circular pressure with your thumb. Perineum, 2 minutes of firm circular massage. Add pelvic floor contractions if they feel comfortable. Corona, 1 to 2 minutes of pinch and release followed by light circular touches. Perform the full sequence once per day. Ideally in the morning when the body is already relaxed, or during a warm shower when heat enhances tissue response. Consistency is more useful than intensity. Steady daily practice beats occasional overly aggressive attempts. This technique does not bring instant results. Your system needs time to adjust. Many men first notice small changes like more warmth in the pelvic region, subtle morning fullness returning, or improved firmness within 2 to 4 weeks. More lasting improvements generally appear after several months of continued practice. Progress depends on individual factors like circulation, nerve health, and overall lifestyle. The objective is steady enhancement of nerve signaling, vascular flexibility, and pelvic muscle support. Keep nails short, smooth, ready for your next section. Keep movements smooth to reduce micro scratches. Wash your hands both before and after. If you prefer another layer of protection, you can wear gloves. Avoid applying pressure to open sores, irritated tissue, or areas that have recently undergone surgery. Should you feel sharp pain, notice bleeding, ongoing swelling, or any numbness, pause immediately and speak with a clinician. Men taking blood-thinning medication or those with bleeding conditions should apply gentler pressure and consult their doctor ahead of time. These techniques operate in 2 key ways. They first deliver immediate sensory engagement to nerves while boosting localized circulation, helping an erection begin. Over time, though, consistent practice retrains pelvic reflexes, enhances vascular responsiveness, and reinforces muscular support. These changes make getting and sustaining an erection more manageable. Think of the process as gently re-educating your body's natural responses with steady, repeated stimulation. Enhance the pressure point routine by adding supportive daily habits. Staying hydrated promotes blood flow and proper volume. Pelvic floor workouts, such as Kegels, improve muscular strength and endurance. Nutritious eating along with cardiovascular activity bolsters vascular function and hormonal balance. Good sleep and stress control further assist nerve health and hormone recovery. Some men explore supplements for circulation and performance. The original reference highlighted 2 frequently mentioned choices: organic watermelon extract, rich in citrulline, which aids nitric oxide production and vessel relaxation, and a more comprehensive herbal blend possibly including tonkat ali, fenugreek, nettle, and citrulline to support testosterone, stamina, erection quality, and prostate wellness. Always choose trusted brands and ask your doctor about safety and interactions before starting anything new. Begin each day with short sessions exactly as outlined. As your comfort grows, gradually lengthen them in small steps, while avoiding too much pressure or excessively long periods. The aim is calm, consistent conditioning rather than intense effort that could irritate tissue. If sensation feels minimal at first, lighten up and let nerves adjust gradually. Too much stimulation early on may cause temporary numbness. Whenever discomfort arises, stop right away and allow the area to recover. Seek medical guidance if irritation continues. Individuals with existing medical concerns, including diabetes, vascular issues, or recent pelvic operations, should speak with a urologist prior to adopting this routine. If no noticeable progress occurs after weeks or a few months of steady practice, or new symptoms appear, schedule a proper evaluation. A drop in spontaneous erections can sometimes point to deeper vascular concerns that deserve attention. You do not need to accept fewer morning erections as an unavoidable sign of aging. By practicing these 3 pressure points carefully every day, you